Thank you. Good evening, everybody. I am thrilled to be giving this award to my dear friend, Janine Clayton. But before we do that, I want to direct you all to the screen for a brief video.
The NIH Office of Research on Women's Health was formed because there was a desire in the biomedical research community to address an unmet need. Many heard the call, and as a result, the Congressional Women's Caucus and others demanded that NIH create an Office of Research on Women's Health. Since its establishment in 1990, ORWH has served as the focal point for women's health research at NIH, working across 27 institutes and centers to expand women's health research, ensure that women and underrepresented groups are included, and promote the career advancement of women in science. The good news is today, women represent over half of the participants of NIH-funded clinical research, and demonstrating that policies such as inclusion policy can have a large impact on people's lives. In 2000, we created the Building Interdisciplinary Research Careers in Women's Health program, also known as BIRCH. BIRCH is a mentored career development effort designed to connect junior faculty with senior faculty with shared interests in women's health and sex differences. We have supported over 750 junior faculty who have become women's health researchers around the world, and the vast majority of them happen to be women. Also, this program is the largest continuing training program for research on women's health, something of which we are extremely proud. In 2002, we created the Specialized Centers of Research Excellence on Sex Differences, or SCORE program, to study and generate data about women's health conditions. This program continues to focus on studying sex differences in health and disease to inform and improve the health of women and serves as a national resource for translational research at multiple levels of analysis to identify the role of biologic sex differences on the health of women. Despite all of ORWH's groundbreaking work, we continue to identify gaps in knowledge about the health of women. And that's why in 2014, the then NIH director, Francis Collins, and I published an article in Nature calling for greater consideration of sex as a biological variable. This catalyzed a national conversation around moving beyond the inclusion of women to addressing the need to study female animals and cells in preclinical research. In 2016, I was honored to lead ORWH in launching the landmark Sex as a Biological Variable, or SABV policy, which requires investigators for vertebrate animal and human studies to include male and female animals and cells or justify single-sex studies. This approach enhances rigor, innovation, and equity. Today, we know sex and gender should be considered everywhere health is the focus. And until it is as automatic as looking right and left before you cross the street, we have more work to do. In 2017, we introduced the Understudied, Underreported, and Underrepresented Populations, or U3 Interdisciplinary Research Program. This program funds research focused on the disproportionate burden of disease and adverse health outcomes that are experienced by some populations of women. Although much work remains, there have been so many bright spots around women's health research, and we look forward to building upon these efforts with the new executive order that President Biden signed on March 18th. I was honored to join President Biden at the White House as he signed an executive order directing the most comprehensive set of executive actions ever to expand and improve women's health research. This order will prioritize investments in women's health research, integrate women's health across the federal research portfolio, galvanize new research on women's midlife health, and assess unmet needs to support women's health research. It's critical that there's a continued focus on women's health research by implementing interdisciplinary research approaches that can integrate biologic and social factors and advance innovation, technology, and cutting-edge science, all to improve the health of women. In closing, it's clear that the path forward holds great promise. Since 1990, ORWH has supported research and policy innovations and career programs to include all diseases and conditions that affect women from head to toe, inside and out, and across the full life course. I'm so grateful to lead ORWH as we continue working to improve the health of all women and the families and communities to which they belong.
Okay, so I hope everyone can hear me. I've been assured by my children that I can get quite loud. Yes, you can all hear me? Okay. So now I get to tell you a little bit about Janine. Janine Austin Clayton is the Associate Director for Research on Women's Health and the Director of the Office of Research on Women's Health at the National Institutes of Health. She is the architect of the NIH policy requiring scientists to consider sex as a biological variable across the research spectrum, because we all know that sex differences matter. This policy is part of, I think that deserves a round of applause. Yeah, let's do it. Woo! This policy is part of NIH's initiative to enhance reproducibility through rigor and transparency. As co-chair of the NIH Working Group on Women in Biomedical Careers with the NIH director, Dr. Clayton also leads NIH efforts to advance women in science careers, because we need to be doing the research, we need to be asking the questions. So thank you, Janine, for making sure that our voice and our experience is represented. Prior to joining the ORWH, Dr. Clayton was the Deputy Clinical Director of the National Eye Institute for 7 years. A board-certified ophthalmologist, Janine's research interests include autoimmune ocular diseases and the role of sex and gender in health and disease. We know that sex and gender are distinct but interconnected in how we experience health, disease, and response to treatments, so another very important area. She's the author of more than 120 scientific publications, journal articles, and book chapters. And I know we're all wondering, where does she find the time to do all of this? Well, because she's just incredible. Dr. Clayton is a native Washingtonian and received her undergraduate degree with honors from Johns Hopkins University and her medical degree from Howard University College of Medicine. Woo, Howard, okay, love it. She completed fellowship training at the Wilmer Eye Institute at Johns Hopkins Hospital and in uveitis and ocular immunology at the National Eye Institute. She's received numerous awards and accolades. In 2021, she was elected to the Board of Directors of the American Association for the Advancement of Science. Those of us who have the privilege of knowing Janine personally can attest to her leadership, her steadfast dedication, and advocacy towards improving the health and well-being of all women. She's also an invaluable colleague, collaborator, and friend. I'm really honored to present the 2024 Health Public Service Visionary Award to Dr. Janine Clayton.
Thank you so much, Kaveeta, for that really, really warm and generous introduction. I think of Dr. Vasisht as my federal sister. We work hard in the federal government to put science to work for the health of women every day. And I'm so pleased to be here this evening with all of you. Thank you, Katie, and the Society for Women's Health Research for choosing me to honor in this way for the Health Public Service Award. Sometimes you're working, but thank you, I appreciate that. What's going on here? Sometimes you work behind the scenes, sometimes you work out front, but all of its importance, and we do that work through policies, through programs, but most of all, through partnership. Collaboration is the key for us putting to science to work for the health of women. I'd also like to take a moment to give thanks to those that helped me along the way. I am so fortunate and blessed to have had an amazing family that has supported me from the beginning. I've also had friends, colleagues, mentors, teachers who have been instrumental in shaping my career and life, and there's so many people that I couldn't really name all of them this evening, of course, but I am going to start with the first person I knew in my life, my mother, who is here with me this evening. The first person I knew and my first mentor. People will often ask you, who are your mentors? What did you do? My mom is an incredible mentor. Dr. Murthy mentioned kindness, compassion, and love as the glue to hold building blocks together. She is the kindness, compassion, and love that holds our family together and has believed in me from the very beginning. Now, Kathleen, you heard that she's a very confident woman, the way you spoke with her. She was in the first class to integrate her high school here in Washington, D.C., Eastern High School. So I'm a second-generation Washingtonian as well. I was born in Freedman's Hospital. Even though she has this kindness, compassion, and love, she is a tough cookie. And if you don't do your best, not good. And I will just tell this little story. She knows I tell this story. That the first book report I ever wrote, I was sitting at the dining room table. I'd never written a book report before. I must have been like 7 years old. And I remember the name of the book. This was traumatic almost. Because my mother would looked at what I wrote and said, you know, you can do better than this. You know, why don't you spend another 5 minutes on this? What that taught me was you need to push yourself, and I have expectations for you, and you should always try to do your best. And that I took with me along the way. I am very fortunate to also have an amazing father, Dr. Kenneth Austin, an amazing husband and daughter who also support me, and I can't say enough about how important it is to have family. When I had my daughter in my first year of medical school, family was what got me through. So I won't say more because I will tear up. So I also want to acknowledge Dr. Vivian Pinn, the first full-time director of ORWH. A mentor who's advocated for women's health issues and concerns to be addressed, and particularly sought for federally funded medical studies to include female patients, and worked to implement the NIH inclusion policy in particular. As the only woman and only African American in her class, her medical school class at UVA, she's definitely a trailblazer, and I've been fortunate to learn from some of the best. And lastly, in medical school, the chair of the Department of Surgery was Dr. LaSalle Lafall, and his motto was equanimity under duress. Equanimity under duress. And he was teaching that when I was learning surgery. I was a surgery intern, and it's about in surgery, that was the context, that you need to have equanimity under duress. The fact that somebody I looked up to had a motto like that made such an impact on me that I took it with me, and it has kept me from falling apart, saying something I shouldn't, and moving forward in a positive way. So I do want to also, again, honor and recognize the sponsors, the organizer of tonight's event, the Society for Women's Health Research, and all the various organizations that support women's health, and the Friends of ORWH, like this, for continuing to elevate women's health research as a priority. There are many women's groups have come together because something was not happening that they thought should be happening, or something was happening in a way they thought it shouldn't, or they didn't agree with. And they demanded to have their voices heard for inclusion and equity, and will continue to insist that their voices are heard. I feel honored to be here among groups of women and men who will unapologetically fight for what they believe in and on behalf of those who may not have a voice. If you'll indulge me, I'll just get a little bit more personal. I've already been pretty personal here. Just say, my career path has not been a straight line, and I think many people think that people who achieve have a straight line. It's just not that way. And if you don't experience obstacles and challenges and view them as opportunities, you won't be able to achieve your best. You won't be able to reach your full potential. It can be easy to allow an educational or career obstacle or life obstacle, qualifying life events, to deter your path and impede your progress, or you can change your mindset and your perception of the path that you're on. So I like to say, find a way to leverage that obstacle and turn it into an opportunity and allow it to energize you in a way that removes its negative power. So I'm not saying that this is easy to do by any stretch of the imagination. However, when you can repurpose that energy, it can be used in a positive and productive way to chart your path and potentially change your life. So I don't think we talk about this enough, and that's why I'm including it this evening. There are curves, twists, turns, and any number of divergent paths we all have in our lives. And that's how medicine has been for me and how research, not a straight path. So in closing, I want to say I am so grateful for the Public Health Service Award and for the support I receive at NIH for ORWH and from all of our partners, collaborators, 27 institutes and centers, federal partners, FDA, and many others. I wouldn't be standing here tonight without the encouragement and collaboration from senior NIH leadership, notably the former director, Dr. Francis Collins, who has shown a real commitment to women's health research and the importance of understanding sex differences, and was a former SWHR honoree. And our current NIH director, Dr. Monica Bertagnoli, thank you for continuing to push for progress as we prioritize women's health research. And to our president, Joe Biden, and First Lady, Dr. Jill Biden, and Dr. Carolyn Missouri here representing the White House Initiative on Women's Health Research for their recognition of the need for more focus and attention on women's health research and on women's health, period, as evidenced by the signing of the executive order on March 18th. I will continue to put science to work for the health of women. And with that, I want to thank you all and again acknowledge my mother, the first person I've known in my life, my first mentor. I love you, Mom.